Hello, I'm Dr. Cindy Purcell, and this poster I did along with Dr. Brandy Ellis. We are both professors in the School of Nursing at the University of the Incarnate Word. As part of the undergraduate nursing program's continuous improvement in nursing education, several years ago, the school identified a need to increase the amount of education in our students focused on primary care and the community, as an addition to the traditional part of acute care nursing. In doing that, we introduced a clinical course that focuses primarily on how to care for the patient in a primary care or community setting, in their home, in a doctor's office, or in a setting where they're being discharged home. In doing that, we realized that our students are primarily very young and probably are not aware of the complexity of managing a chronic illness as an individual when it comes to the daily management. And most importantly, the costs and just the confusion and the complexity of managing sometimes just that one aisle in the retail setting that has all of the pain relievers, the cough and cold relievers, the vitamins, the supplements, and some of the other materials people need, for instance, things for wound care management or diabetic management supplies. So we devised a clinical where we sent our students in groups out into community retail settings, small and large, to explore these areas. And before they went out, they were given a real life scenario, a real life setting. They have a patient that they have seen in a primary care setting, an outpatient visit, and they have a task of going to find the things this patient needs to use, along with discovering the complexities of just navigating finding a low dose aspirin, for example, or the cost of vitamin D or fish oil supplements that your physician might recommend. We tasked the students with collaborating with the retail pharmacists. They spent time talking with them about the medications that were prescribed for their patient, the options for different languages on labels, the options for larger font on a medication label. And they received copies of the patient information sheets and analyzed those for readability and complexity as well. After spending time together in several retail settings, the students came back together and had a debrief and compared notes and really shared very much their surprise, their awe, the shock at the complexity of what they found, and the fact that nurses need to know this. How would you know how to tell a patient where to find low dose aspirin when their prescriber told them to start taking baby aspirin? And yet there is nothing on the shelves today that would indicate a baby aspirin. So I think the implications that Dr. Ellis and I have found for nursing and for the future research in nursing is, do we need to explore settings outside of hospitals and traditional care settings where a provider is the mainstay of the care being provided? And do nurses need to go and be educated about what it means to have a complex chronic illness, how to help their patients and clients navigate the retail settings, where prices are higher, where prices are cheaper, what types of programs are out there for them, and how to request that their medications be dispensed in a manner that is actually more fitting to their readability and their language. I hope you enjoy the poster. We thank you very much for stopping today. Have a great day.